I was incredibly devastated when I was diagnosed because I never expected my life to take that turn. So I was immediately scared that I was kind of going to be on the downslide at any moment. That was my biggest fear is my kids are 2 and 4. They're not even going to remember me.
I was officially diagnosed when I was 28. It was November 2014. I was a new professor at that time. I was diagnosed with, I think, 2 months on the job. So I was really concerned about how that would work going through chemo.
On Halloween, almost 6 years ago, after having a lot of back pain, I got up out of bed and fell to the floor and could not move. Turns out it was a compression fracture of my T11 vertebra, which was brought on by the cancer I have. And I love my wife, and the thought of leaving her was not pleasant to contemplate.
I am absolutely alive today because of breakthrough therapies. Absolutely.
If anybody can learn anything from what I'm going through, I want to tell them.
I expect to be in continuous treatment till I die, and to have to use different drugs that exist and those that don't exist, to keep me alive till I'm 95, hopefully. The work of Friends of Cancer Research is critical to the development of those drugs.
We must build on what the nation has already accomplished and launch a new war on cancer for the 21st century. We stand on the threshold of unprecedented new advances in life sciences.
Cancer touches everyone. In 1986, my beautiful 40-year-old sister died of breast cancer, leaving a 4-year-old child. It left the entire family devastated, and it changed our lives forever.
My father died of cancer at an early age, and then my mother-in-law passed away, and I was thinking, what can I do to help? So I decided to go back to nursing school and become an oncology nurse. Cancer affects everyone's lives.
For me and so many, it's about the patient, and it's personal.
I said, it is personal. It's personal for so many. But I believe we can do this because there are so many breakthroughs just on the horizon. Think of how many people you know who are saying, you docs who are saying, Doc, I just want to make it one more month to see my daughter get married. Time matters. Days matter. Minutes matter.
Friends of Cancer Research has fundamentally changed how cancer is battled through driving collaboration among partners from every healthcare sector to power advances in science, policy, and regulation that speed life-saving treatments to patients.
Friends was started in 1996 when we were recognizing the 25th anniversary of the National Cancer Act.
At that time, Ellen Siegel and Marlene Malik set out to bring together researchers, leaders of federal health agencies, industry, and elected officials through town hall events across the country to discuss ways cancer treatment should improve.
Friends of Cancer Research has been a very powerful influence on advances in how we can ultimately figure out how to prevent and cure cancers.
In those days, the FDA was a black box. We didn't know anything about it other than we didn't like it and we didn't even know why.
Friends understood they had to break through the black box that was the FDA in order to enact real change. Because of Dr. Rick Pazder's transformational leadership, this vision was realized.
We recognized that there was a lot of work to do at the regulatory area, and the consolidation of cancer at FDA was going to be a large and important factor in getting treatments to patients. So we shifted our mission about 10 years ago and focused on that component.
We depend upon the kinds of input that Friends of Cancer Research can provide about creative ideas that we can then push forward. So it makes a wonderful kind of community now of government, advocates, patients, all really working together at this exciting moment in cancer research, which has such promise, but we don't want to wait for that. We want it now.
The breakthrough designation has been, I think, a very significant advance. It has really allowed us to say the early clinical promise of this particular candidate drug is so significant and meaningful in terms of other therapies that are available.
If the drug is so much better than anything out there for that disease, we don't want to wait 7 years while it's tested in phase 1, 2, and 3, okay? And the agency doesn't want that, the developers don't want that, and certainly the patients who don't have good alternatives don't want that.
Since breakthrough therapy was written into law in 2012, there have been 145 designations granted, with more than 40 of these critical therapies approved by the FDA.
The Lung MAP protocol is so exciting and so important. Scientists, patient advocacy groups, and the regulators can come together to create a novel platform.
I think that is a wonderful partnership then between NIH, between FDA, who has to oversee the trial design, and between the friends to come up with new ways that will be more effective in getting us the answers we're looking for as quickly as possible.
Friends is successful due to their ability to convene the right people at the right time and put forth revolutionary yet realistic ideas. They will continue to be instrumental in the creation and implementation of future policies, ensuring patients receive the best treatments in the fastest way possible.
You want to fight to stay alive, and you need to find the best treatment that there is in the world, because it is your life and you want to stay here.
It may sound strange, but I feel like a very lucky guy. I have cancer. It's not curable, it is treatable, and there are drugs to treat it. And there are more being developed right now.
When you're diagnosed with something like a terminal cancer, you feel like all your power's taken away, and you feel like you're slipping, and you're angry. And I think at the time, the anger really pushed me to want to change things and to want more people to be involved and more people to understand what this is like and why it's so important to give time and funds and help make a difference.
For the loved ones we've all lost, for the families that we can still save, let's make America the country that cures cancer once and for all.